Hey guys, it's Nicole, and as always, this is a Nursing Bite. One of you viewers had a question regarding toxic work environments, and trust me, I've been there. The person who wrote me wants to make a change to the floor, and they're having a hard time doing that, and she wanted my advice. And to be honest with you, if your leadership is not going to support the change, you're going to be banging your head against a wall. I have attempted to change floor cultures. I've gone to leadership, one, two, three tier leadership. But if they're not going to support you in changing the floor culture and listening to the concerns that you and your fellow coworkers have, it's not going to change anything. All you're going to do is be spinning in a circle. There are some cultures that are so deep rooted that people are stuck in. You're going to have to just realize that you need to preserve your personal peace and move on. Now, leaving a job is very difficult to do. In the current climate, I would not recommend you bouncing from a job. But if it is causing you emotional distress to go in, if you are having panic attacks in your car, I know when we see the Instagram little jokes, the memes about nurses crying in their car, we find it funny because we all have been there and we have those moments. But if those moments are regular to you, if you being depressed is regular to you when you go to work, if you have severe anxiety with each and every shift that you have, that is not healthy for you. Whether it's self induced or environment induced, the point being is that it's not good for you. So many people in leadership are trying to explain that resilience is a nurse's problem. We need to teach nurses how to be more resilient. No, no, no. You need to create a more supportive environment for me to develop and grow. That's completely different because when leadership says they need to be more resilient, that's like I need to work on me and you don't need to do anything. And that's not necessarily fair in my opinion. Whether the toxicity is based on the patient to nurse ratio or coworkers or leadership or even providers like doctor, PA, or nurse practitioner, or auxiliary staff, whatever the reason may be, sometimes that culture is not going to change just because you and two people wanted to. You have to have leadership support to support the transition of the change, or it's not going to work. I don't know in your case if you have leadership support, but judging from your message, I don't feel that. And if you've been trying to change this for like 6 months or a year, call it. Just call it. Just call it. It seems like it's stressing you out, and there are some things in life that you will have no control over. There are some places I've worked at where I love my patients. I love my patient population, but toxic. I had to go. I had to go. And that's okay. It's not defeat. It's you choosing yourself over this crazy environment, and that's okay. That's our nursing bite for the day, folks. Questions, comments, put them on the bottom. But until then, have a nice day. Bye. I think it went well. You know what I mean? I think it went well. I'm trying new foundation, Fenty Beauty. I haven't worn makeup in legitimately 4 years. And I was like, oh my God, I could look better. Like I'm already Goblin esque. Like I'm already a negative 5. But this is just one step. I don't have contour. I don't have all that other stuff that the YouTube people have. The YouTube people have 48 products. This is one sheer application with a sponge. Imagine if I like had all that stuff, brightener and under eye and setting powder and setting spray. Could you imagine? Could you imagine